So this is the thing, when we have accessory muscles and O2 sats are 88%. Okay, do we need to worry about O2 sat 88% in asthma? Yes, because if somebody is having COPD, yes, so if somebody is having COPD and on 88 and not using the accessory muscle, then we can say like, okay, that can be normal for COPD. But in asthma, using accessory muscle, yes, it is respiratory distress and SAT is sitting on 88%, so definitely A is the priority. Okay, what about B, guys? A patient with COPD with chronic cough and 2 plus pedal edema. Is B correct? No. Yes. Why no? When we are having chronic cough in COPD and pedal edema, what does pedal edema indicate in patient with COPD? What's happening there? What it is indicating? Is there a specific condition that this fluid? Definitely. What else can be? Yeah, they okay. Chronic 2 plus is okay to monitor, definitely. So we are having, in this patient, we are having right-sided heart failure. Okay, so when you have right-sided heart failure, there is a, yes, yaw, definitely, then there is a fluid accumulation in the body. Okay, and chronic cough pedal edema is common chronic symptom of COPD and right-sided heart failure. Okay, so they just need to be managed, they are not acute life-threatening change. Okay, so we are gonna just wait for B. Okay, option C, a patient with TB in airborne isolation requesting water. So he's in, patient is having, yeah, no, yeah, because is he settled? Yes, definitely yes. This is a routine request. Okay, C is no. This is a routine request. Okay, so it can be assessed after higher priority patients, such as we got A, you know. So, and he's in isolation also. Even though if he's in isolation, it's not our priority. Okay, sometime student get confused about isolation. He's just in isolation for safety. Okay, yes, definitely, JJ, we can delegate that to someone else. Let's move to option D. So patient D is with pneumonia and new onset confusion. Okay, yes, new onset, always acute have priority, and now we having 2A, A for airway, A for acute in this one. Okay, so that's why this one is a worry. Okay, what can happen if we will not intervene? What can happen? Change in LOC? Yes, definitely change in LOC is the sign. Because new onset confusion, new onset infection, yes, sepsis, yes, definitely. Okay, it is the sign of hypoxia, it is sign of infection, sepsis, so brain enough oxygen, and it is one of the life threatening condition, especially at systematic level, affecting the blood. So, and this is a severe breathing issue. Okay, this is severe breathing issue right now going on, hypoxia. Okay, so B, and if it is sepsis, then it's gonna include circulation also. Okay, so D is correct, we will manage that one also. So E, patient E with pleural effusion reporting pleuritic chest pain. So pleuritic chest pain is it issue? Yes, yes, yeah. definitely we're gonna look after this patient also as a priority. Even though pleuritic chest pain is common symptom of pleural effusion, okay, we still need to see this patient, because if we are having patient reporting chest pain, it is indicating that patient is can develop complication, okay, emphysema, pass in pleural space, or can, yes, it can be life threatening. Yeah, definitely. Because it can be worsening in the condition, it can produce other complications, so we're gonna see E also. Okay, now we know we have patient A, D, and E. Yeah, so which one we gonna see first from these three? We don't need to worry about these in NCLEX exam, because you don't need to choose three patient over there. Okay, this is for just our practice. This is just to see like how we gonna prioritize our patients. Yeah, patient number one. Yes, instead is choosing one option, you are just better guess and other choose. In select all that apply is choosing one option that you are sure of better guess. Okay. G2 King, mainly SATA question doesn't come with prioritize. Okay. SATA question comes with like med surge, like what kind of priority we have for that patient. When we need to prioritize patient, you need to choose only one. Okay, so here we are good, we are just practicing, we are just suppose you are working in emergency department, you got all the three patient together, so that's why we are just expecting. Okay, in while providing the intervention, while diagnosing, those question can be SATA, where select that all apply come more, where you have to do multiple things all together for one patient. Okay, you can get SATA in pharma. Yes, like we have done pharma a lot, and I have uploaded those questions on YouTube anyway. Okay, so who agree with A first? Yes, are we gonna go with A, and then we'll take well E? Yes, yes, yeah. Yeah, so definitely. So A will be our first priority because it's affecting the airway also. And D can be the priority also because it is affecting airway and it is very acute. Okay, this is new onset confusion. So we can move to ADE. Yes, that's correct. Okay, let's move to question number 12 now. Yeah. So the nurse receive report on 4 patients which should be assessed first. Actually, there is 5 now. Okay, a patient with tracheostomy tube that dislodged, a patient with NG tube reporting nausea, a patient with esophageal varices coughing up blood, a patient with pancreatitis reporting severe abdominal pain, a patient with kidney stone requesting pain relief. Okay, which patient we are gonna go first? Question number 12, guys. Definitely A. Yeah, definitely A. Yeah. Okay, because what happening in A? What can happen when we have dislodged tracheostomy tube? What can happen over there? Is it immediate risk? Airway will close. Yes, definitely. Is it immediate risk, guys? Airway obstruction? Yes, it is actually immediate and critical threat to patient airway. Okay, so the nurse should act immediately to reinsert the tube to prevent the suffocation, and this is highest priority. This is airway priority, so this is highest priority, so we definitely gonna see patient number A first. Okay, a patient with NG tube reporting nausea. B, Thank you guys for sharing the live. Please keep double tapping and share the live. Okay. Is nausea expected? Can they see? Yeah, because why it is expected? Because it can be due to the positioning, it can be due to the improper suctioning. Okay, so while it need to be addressed, it's not the immediate life threatening emergency. So this can be looked after later. Okay, a patient with esophageal varices coughing up blood. Okay, C, yes. What's going on with C? What's going on with C? What can happen? Can it convert to life threatening emergency? Yes, it can actually, because when patient cough up blood with esophageal varices, it indicate ruptured varices, bleeding, aspiration. Yeah, it can lead to massive hemorrhage and hypovolemic, just JJ, hypovolemic shock. Okay, so this is also important, and because circulation C, we will look at C also. Okay, a patient with pancreatitis reporting severe abdominal pain. What about D, guys? We have pancreatitis patient. I think we have done that yesterday also. You guys can check our live on YouTube. Yes, what can happen with pancreatitis? Severe, yes. D, yes. Okay, we know it is yes. What is the risk here with patient number D? What is the risk here, guys? What is the risk for patient number D? Burst? Yes, definitely. What else can happen? What it is indicating when we have pancreatitis reporting, patient with pancreatitis reporting severe abdominal pain? Yeah, so when patient is developing severe abdominal pain, it is indicating like, there can be pseudocyst. It is Remy, it is expected, but it is like now a lot of complications going over there. So it can be necrotic, it can be rupture. So that's why it can lead to life threatening sepsis, life threatening hemorrhage. That's why we need to look after. Okay, we need to do immediate assessment. Yeah, so we will definitely see patient number D, a patient with a kidney stone requesting pain relief. Yeah, what about E, guys? Peritonitis? Can be, but pancreatic pseudocyst is most common, and necrosis, yeah, and rupture is. Okay, yeah, alrighty. So E is expected. Okay, when we know there is a kidney stone, pain, it can be moving, the stone is moving, so pain is expected. Okay, yeah, yeah, cyst rupture, definitely. Yeah, definitely, Nico. Okay, now we have patient A, C, and D. Which one is priority? Yeah, which one is gonna we see first? I know sometimes it can be complicated, but like we need to just choose A. Yes. Okay. Tracheostomy tube, definitely A. Okay, and after that, who we gonna see after that? So we have hemorrhage here, and we have sepsis here. Yeah, yes, Corey. Yeah, that's what we are seeing. A, then C. Yeah, yeah. So I think C is, firstly we will see A, and then we will see C, and then we will go to D. If we get all together, they will never come together like this. This is super hard. Usually in the questions in the exam, it is simpler than this. Okay, you need to choose only one patient. Yeah. Sure. So we will see the A first, and then we will see the C because of hypovolemia, and then we will see the D. Okay. When we are saying patient is having sepsis, yeah, yeah, the mere fact that you have, yeah, that's McJack we already discussed. Like, it can be improper suction, it can be positioning. So we will try all these stuff first. Yeah, that's why. Yeah, yeah, it might not be incorrectly. Yeah, yeah, B is can be positioning. So we will do ACD. Alrighty, let's move to question number 13. So the nurse had 4 patients in oncology unit which require immediate intervention, guys. Select all that apply. Okay. A neutropenic patient with fever of 38.5, a patient receiving chemo with oral ulcers, a patient with spinal cord compression and new leg weakness, a patient with a syndrome of inappropriate antidiuretic hormone and sodium 118, a patient with alopecia requesting a wig. What we're gonna see first? Let's move to patient number A. ACD, Nico? Yeah, good one. Good one. Definitely ACD. Okay, why we're gonna see A first? He's neutropenic. Is it medical emergency? Is neutropenic patient having fever is medical emergency? Immunocompromised? Yes, definitely. Yes. So when if neutropenic patient is having fever, it is medical emergency because it can be septicemia. It can be septicemia and patient doesn't have enough low white blood cell count. So that's why they can't fight the infection. Yes, they need antibiotic as soon as possible. Okay. Yeah. So we need broad spectrum antibiotic in this patient. So A, we will do that. Okay. And it is affecting the circulation definitely. Patient number B, chemo with oral ulcer. So we have stomatitis here. In patient number B, we have oral ulcer, stomatitis. Is this priority? Yeah. Is this priority? No. Okay. And in chemotherapy, in last our pharma session, our last pharma live, we have studied like they can develop. It is common but painful side effect, okay, of chemotherapy. So they need to be treated, but it is not life threatening. Okay, it is not life threatening, so they can wait. Okay, let's move to C. A patient with spinal cord compression and new leg weakness. Is C can be the issue? Yes, yes, definitely. Okay, what is happening over there? We already have spinal cord compression, we know that can be, but this is new. Yes, definitely, it is acute and it can indicate that person is having more and worse neurological deficit now. Yes, so this is acute, so we are gonna see C patient also. Yeah, see them as possible. Yeah. Okay, next one, patient number D. Yes, Joy, it can be fracture and it can be more compression, so we need to sort out that patient. Yeah. Okay, a patient with SIADH and sodium 108 mmol per liter. Alrighty, D. What can happen? What can happen? Yeah. Yes, hyponatremia. We are having severe hyponatremia here. Okay, so seizure, coma definitely can be there. What else can be? Because they can go into hypotension, they can lose all the fluid, dehydration, you know. Yeah, cardiac arrest, everything can happen. So we need to worry about D. It's about circulation. Okay, A patient with alopecia requesting a wig. This will be the easiest answer, like it is common side effect, definitely. Yeah, so we don't need to worry. We know it is common side effect. We know it is body image issue. We know wig is for comfort, and we know comfort come at last. Okay, so it is not immediate emergency priority. So that's why this patient can wait actually. Okay, so E is good. Okay, now we have patient. Hello G. Now we have patient A, we have patient C, and we have patient D. Yeah, so which one is more important right now? Which one is more important right now? C, D, A. Yeah. Um, can we go to D first? Do you think? Because what we can do in C is gonna be immediate action. A, C, D. Yeah. Will there be any immediate action C we need to do? And is broad spectrum antibiotic, we know we need to start. It is new queen, it is definitely new, with because in option A we know it is broad spectrum antibiotics. Yes, C is just we need to prepare for surgery. Okay, yeah. D is immediate. Okay, A we can give antibiotics, but antibiotics gonna take some time. We need to have some fluid in neutropenic patient also. Okay, so we can go to D, and then D will be the first because 118 is going into sphere. ADC, yeah, we can do ADC also. Okay, but C is mostly, yeah, because this one can go into seizure, this one can go into cardiac arrest, coma, loss of consciousness also. Yeah, so we need to make sure this. I know we are having new leg weakness over there. This one we just need to report. Okay, there is not much we can give. We can do the this one we can't do much from our side. Okay, this one we need to report. Yes, C is important. They limit the movement but not immediate. Yes, Joy, definitely. Okay. Yeah, yeah. So we will go D first. We will go to A first because A is gonna take some time, and then we will go C. Okay. Cheeto King, I will make definitely one video today on SIADH, and then I will post it. Promise. Okay. You have too much anti diuretic hormone ADH. Okay, you have too much ADH. And what is the function of ADH? Anyone? What is the function of ADH? What is function of ADH? Uptake of water, hold water. Yeah, yeah. Nice. Balance fluid electrolytes, definitely. So what can happen in this one? So we have too much ADH now, vasopressin. Okay, so basically kidney control the amount of water, and excessive amount of ADH can body can retain too much water now. Okay, it will not let kidney excrete the water. Okay, so when now you don't have enough sodium in body but you have too much water, what's gonna happen? Decrease serum osmolality, yes, definitely. Hyponatremia, definitely. Okay, so those are the things, and we know that sodium is required for the action potential of the nerve. That's how they transmit the information. And then sodium is required for the muscle fiber action potential also. Okay, so now we have less sodium in our body as compared to the water. What's gonna happen? CNS effect, yes, loss of consciousness, coma, drowsiness, everything. And what's gonna be seen? Muscle. Yeah, sodium goes, water goes. What's we gonna see in muscles? Can we have muscle cramp? Yeah, muscle cramps, weakness. Yeah, seizures. Yes, definitely. So that's how we, yeah, less muscle function, definitely, Janal. So that is SIADH. Okay, I will make a simple video on that one and I will post on YouTube also. Okay, let's move to question number 14. Thank you, guys. In nurses caring for patient with endocrine disorders, which should be seen first? Select all that apply. So a patient with DKA with fruity breath and ketone is 6.5. Guys, okay, 6.5. And a patient with hypothyroidism reporting fatigue. A patient with Addison disease and BP 78 by 40. Okay, blood pressure is 78 by 40. A patient with hyperthyroidism and reporting palpitation, and patient with SIADH and confusion. Yeah, so let's move. These questions are really good. These questions gonna help you guys a lot, really, with actually critical thinking, rationalizing. These are the best questions you guys can do. Okay, and it will be posted on YouTube nursing. It will be posted. This live session is gonna be there. Okay, so you guys can watch anytime. We are uploading all our previous live also. A, C, D, E. Okay, let's move to A first. What we are having here? DKA, diabetic ketoacidosis. Okay, what can happen we have when we have lot of potassium in our body, higher potassium? K plus need insulin dextrose. Okay, is it immediate threat? Yeah, cardiac arrest. Yeah, so definitely A is our priority because hyperpotassium, hyperkalemia can cause that one. Okay, it can cause arrhythmia and that can lead to cardiac arrest. Okay, a patient with hypothyroidism reporting fatigue. Is it expected sign? Is it expected sign? Yes, definitely. So hypothyroidism usually have fatigue as a common and expected symptom. So okay, and hypothyroidism is a chronic condition. It's not acute, it's not life threatening. Okay, so we are not gonna see B yet. A patient with Addison disease having BP 78/40. What's going on here? What we see is he is going through crisis. Yeah, Addison crisis. That's definitely she is going through Addison crisis. Now we don't have enough cortisol produced by adrenal gland. Okay, and that's causing the severe hypotension 78/40, and it can lead to shock. Everyone agree? It can lead to shock. Okay, so that's why we need immediate administration of IV fluid. And what else we can give to this patient? What else we can give to patient C? Definitely we're gonna give IV fluid, but now patient is in Addison crisis. Steroids. Yeah, glucocorticoids, corticosteroids. Definitely C is right answer. Okay, a patient with hyperthyroidism reporting palpitation. What about D, guys? Is D expected sign? Yeah, everything goes up in hyperthyroidism, high metabolism going on, so that's why palpitation is very common and expected sign. Okay, so it is not immediate life threatening. Okay, unless if patient was saying hyperthyroidism reporting palpitation, but if they will say like with chest pain, yeah, shortness of breathing, or maybe VTech, okay, then we will worry about this patient. Otherwise, we can just leave it right now. Okay, a patient with SIADH and confusion, yeah, sudden onset of monitor, definitely. We already done E in last one. It is expected, but it is not expected. What's happening now? Low sodium, yes, severe hyponatremia. Okay, we really don't want to lead to the confusion. Okay, we really don't want to, because once you will start having the confusion, it can lead to the seizure and coma. Okay, so what we need to give in this patient, what we need, yes, definitely, what we need to give this patient, how we can manage, what is the quickest thing we can give. Are we gonna give fluid? Are we gonna hypertonic saline? Definitely. We need to restrict the fluid, okay, and we're gonna administer hypertonic saline, okay. We don't wanna give too much fluid. Only hypertonic saline is gonna be working there, okay. Okay, now we have patient A, and now we have patient C, and now we have patient E. Okay, which one we are gonna see first? I know all of these three are equally important, okay, we already discussed, but expect like you get these patient with you, okay. Sydney C, yes, definitely we can go with C, okay, yeah. Okay, E is emergency also, because E also you are having hypotension, hyponatremia, severe, okay, and this is going into the brain, neurological emergency, okay. A, what can happen in A? What can happen in A? And what we can prescribe to patient A when there is severe hyperkalemia, when there is severe hyperarrhythmias, yeah. Is the insulin? Yes, insulin is one of the thing, yeah, because there's calcium gluconate just to stabilize the cardiac membranes, definitely. Okay, is everyone happy with C, E, A, or shall we change it? Yeah, yes, Milda, definitely. Yes, because our goal is to do at least 20 questions today. Yesterday we done 10 question in 2 hours. CAE, yeah, I got it. Is okay. Let's move to question number 15. We will have break on question number 20. Okay, we will have 5-minute break on question number 20. Yeah, JJ, we can do say CAE also, because that can cause cardiac arrest. Definitely, we can do A. A nurse is caring for 4 surgical patient. Which finding are emergent? Select all that apply. Okay, so now we have a patient with new stridor after thyroidectomy. Now we have patient with post tonsillectomy, swallowing frequently. We have a patient with abdominal incision with serosanguineous drainage. We have a patient with chest tube with continuous bubbling in water seal, and we have a patient post lobectomy with tracheal deviation. Yeah. Okay, let's do A. A is stridor. What's happening with A? Blocking? Yes, A is blocking. Okay, there is a upper airway obstruction, so that can be life threatening, so we are gonna say A. B is bleeding. Yes, you guys already commenting B. So B is bleeding. Yes, this is when patients start swallowing frequently after post tonsillectomy. It is indicating hemorrhage. Okay, so we need to be careful, and definitely we are gonna look into this one also, because patient can aspirate, patient can have shock, patient can have hypovolemia, anything. Okay, depending how much bleeding going on. A patient with abdominal incision with serosanguineous drainage, is it expected? Is it normal? C. Yeah. Yeah, yeah, definitely. C is expected, okay, especially within the first 24 hour. It is not a cause of concern, okay, pinkish watery fluid. Okay, so we can leave C. What about patient number D? A patient with chest tube with continuous bubbling in water seal. What is D? Yeah, yeah, yes, air leakage, but is it life threatening? Is it life threatening? We are having mixed answer. Sometime we need to see, okay, sometime we need to see, because what time, yeah, we need to call the provider, and it can be normal finding, especially like immediately after post operative period. Okay, so we need to monitor it whether it is a persistent leak or not. Okay, so yeah, it depends on what's causing it. So right now we are not gonna worry about D. Okay, a patient post lobectomy with tracheal deviation, it can cause, but like we are right now not sure what's happening. Okay, a patient post lobectomy with tracheal deviation. What about E, guys? What's happening in the E? Is it life threatening? Deviation, airway, tension, pneumothorax. Definitely building up air in the pleural space. Yeah, so it can push the trachea, it can push the heart to other side. So it's severe breathing and circulation emergency. Okay, it need to have immediate needle decompression. Yeah, if everyone happy with that, we will do E first. Oh, we will do E also. Okay, now which one? This is just, extra question. Which one is the most important? Which one is most important, guys? A, if it's airway, yes. A, yeah. Okay, because if we are just EAN, yeah, yeah, but because A is actually we know A is having right now. Okay, the E is also compromising the airway. E is also compromising the airway, but like, can we sort out A first or not? AEB, can we do that? AEB. Because like, in B1 we need to tell provider also. Okay, we need to inform provider. That's the only thing right now currently we are gonna do. Okay, yeah, A required assessment report. Okay, but it can be the obstruction straight away. So we need to, okay, we need to prevent the airway. What do you guys think? Or shall we do EAB? Come on, guys. Kemi, it is not expected. It is not expected. Yes, we can do EAB. Yeah. Okay, we can do E, we can do A, and we can do B. Okay. Yeah. Okay. Yeah. So what's happening with this one? This is expected, or this is not expected. We need to make sure like why it is happening. So we are just discussing in context of this question. Okay, so we discuss like we will monitor this question, we will monitor this person, and we will see how much bubbling is going on. Okay, so it can be air leak. Yeah, it can be air leak. And basically in the exam you only need to choose most of the time prioritize question. Yeah, only one patient. So this is just extra thinking. We are trying to think like, okay, which one is more important. Alrighty, let's move to question number 16. So in nurses caring for post transplant patient, okay, which require immediate action. So a patient with kidney transplant with urine output less than 30 ml, a patient with liver transplant with temperature 38.8, a patient with heart transplant reporting chest tightness, a patient with pancreas transplant with mild hyperglycemia, and a patient with immunosuppressant reporting sore throat. Which patient we are gonna go, guys? Which patient is kidney transplant? Yes. Less than 30 too low? Yes, definitely we gonna see a. What is happening if kidney transplant patient having urine output less than 30 ml per hour? What is happening over there, guys? Please follow, please double tap and share with your friend. Make sure you guys follow. Okay, what is happening with renal compromise? So no blood flow. Yeah, and because this is the transplant, okay, this is transplant, it can be the signs of kidney rejection. If you guys agree, it can be sign of kidney rejection. Okay, and it is critical finding. Okay, so we need to check that one. There can be a blood clot, there can be blood clot in like renal artery or vein, or it can be blockage in ureter also, simple thing, but it need to check because it can cause severe complication. And the reason why I was saying like it can be kidney rejection, so that's why we need to find it out what it is causing. Okay, so A is correct. B, a patient with liver transplant with temperature 38.8. What's happening with B? What is happening with B? Is fever common? Is it serious sign? Is it life threatening? Rejection, potential sepsis? Yes. Okay. Because a fever in patient, it can be infection, it can be transplant rejection. Okay, so we need to find cause of like what's going on there, and we need to investigate, we need to treatment with antibiotic, or we need to provide immunosuppressant as soon as possible. Okay. B, okay, a patient with heart transplant reporting chest tightness. What's going on with this patient? C, yes, yes, no, and me. C is definitely yes, because same thing again. This is the sign of transplant rejection also, and then there is a one condition, allograft vasculopathy. Okay, and that is a coronary artery disease, especially in the transplanted heart. It can be life-threatening cardiac event. Okay, so C is gonna be there. C is gonna be there. Yeah. What about D, guys? What about D? A patient with pancreas transplant with mild hyperglycemia. Is D expected? Is it common? Mild monitoring. Yes. Because now pancreas is trying to adjust to new body. Okay, and it is not an immediate life threatening emergency. Yes, need monitoring definitely, because it's mild hyperglycemia. Okay, so we don't need to worry about that one yet. We will keep monitoring this patient. A patient with immunosuppressant reporting sore throat. What about E? Is E expected? Is it no? Yeah, because we know patient is on immunosuppressant, and sore throat can be earlier sign of infection. Okay, yes, I am a definitely it can be earlier signs of infection, because if somebody is having high fever, that can be life threatening. Okay, so we will just report this patient to provider because it is earlier sign, it is not life threatening right now. So a patient need to be just assessed, and but they are not on top of priority right now in context of this question. Okay, okay, now we have patient A, patient B, and patient C. And actually I think like all of these are very important, so we will just discuss what we're gonna do with these patient. Okay, so A definitely need, what kind of help A will need? Anyone? Immunosuppressant, most of them, if you guys agree, and depend upon other symptoms, and then like because body is rejecting, so can we give immunosuppressant to them, or do we need any other? A going back to OR? Yes, definitely they are going. And then, yeah, that's Jen, we do have like people watching from everywhere, so definitely C first, heartburn, yeah. CBA, yes, we can do CBA. Okay. I am a definitely they need to be on immunosuppressant. Okay, especially we need to B can be on immunosuppressant. Yeah, yeah, B can be on immunosuppressant. C need immediate evaluation because it can cause life-threatening cardiac event straight away. B, we need to save the transplanted organ, so it need investigation. So we will do C, and we will do B, and we will do A. Okay, thank you, Nursian, thank you. Okay, let's move to question number, yes, C first. Okay, let's move to question number 17. So a nurse is caring for patient with neurological issues, which should be prioritized. Select all that apply. A patient with stroke and new slurred speech, a patient with ICP monitor and sudden decrease in LOC, a patient with multiple sclerosis requesting assistant ambulating, a patient with Guillain-Barré syndrome with shallow respiration, and a patient with Parkinson's requesting help eating. Okay, guys, let's move to option A. What is happening with A? It's new slurred speech. Yes, it's new slurred speech. So that is indicating like we are having worsening stroke or new stroke. Okay. I hope they not all on the same floor. Okay, so A is definitely we're gonna see this one. Alrighty, are we gonna worry about patient number B? We have patient with ICP monitor. Okay, and now we have sudden decrease in loss of consciousness. Yes, okay, a sudden decrease can indicate like rapid increase in ICP. Okay, and that can lead to brain herniation, that can lead to coma, that can lead to death. So it's higher priority neurological emergency. Okay, yeah, so B is correct. uh, yeah, sudden anything is always a concern, guys. Yeah, what about patient D, multiple sclerosis requesting assisting? He's just requesting assistance. Is it common and expected finding? No, yes. So this is very common, and this is for comfort also. Hello, Alfreda. Okay, they chill, so we don't need to worry right now about C. It's not life threatening anyway. A patient with Guillain-Barre syndrome with shallow respiration. What about D, guys? Shallow respiration. What's happening there? Yes, definitely, because it's indicating rule out D. We need to look into this because it can be paralysis. Yeah, anyone wanna tell a bit more about Guillain-Barre syndrome? Need incubation? Yes. ABD? Yes, definitely D is there. Okay, so we are gonna worry about D. Okay, because what's happening in this syndrome, body is attacking our own neurological, nervous system, muscles are tightening, diaphragm. So when we say shallow breathing, diaphragm is not working properly. So D definitely we need to worry about because of airway. Yes, it affects breathing and muscles function. Yeah. Okay. E, a patient with Parkinson requesting help eating. What about E, guys? Is it common? Yeah. E, no. Yes, E, no. It is common, it is expected, and it is in safety, nutritional issue. Okay, it is not very immediate life threatening emergency, so we don't wanna worry right now about this patient. Okay, we can leave him for last. Yeah, it can be delegated, to UAP or IT. So or we can come back to this patient later on. Yeah, guys, please double tap and follow. Please double tap, really appreciate everyone. Okay, now we have patient number A, we have patient number B, and we have patient number C. What we gonna do, guys? Who you gonna prefer? Thank you, officer. Thank you. Really appreciate. A. Are we gonna go to A first or B first? D. B A D bad. Are we gonna do? Yes. Okay. B is sudden also. Good morning, Margaret. We will definitely lead D to the last. What about A and B? Yes, can we do A and B? Yeah, because A can have new stroke also, recurrent stroke also. In D, the reason why we don't wanna go straight away, because we know this person is having Guillain-Barre syndrome, and that's why he must be on IVIG. If you guys uh, understand, like, immunoglobulins and plasma exchange, that's the only thing. He should be on the treatment already. Okay, if we are just gonna consider uh, if we are just gonna, because this is not acute and there is no cure, guys, there is no cure for this person. Okay, we need to give his shallow respiration. We don't have any SpO2 with us right now, and we understand that this syndrome is gonna affect our muscles, affect our diaphragm. So that's gonna keep happening. If we will have SpO2 here like maybe 82 or 85, then definitely we will go for the mechanical ventilation. If breathing is that difficult, but if shallow is managing, we need to see. Okay, if shallow breathing is managing, we can work around that one. So yeah, yes, I think so, because this is sudden decrease in loss of consciousness. Okay, Joy, and because this is neurological life threatening emergency, so we need to, because what's happening, sudden decrease, patient is on ICP already, patient is at risk of bleeding, hemorrhage, and he it can be, lot of things. Yeah, let's do BAD, guys. Okay, so if everyone agree, that's okay, but if you have your own rational, that's okay also, because the thing is that this is gonna be different for everyone. Okay, how we think, how we process, it's gonna be different. Let's do three more, and then what we will do, we will have a 5-minute break. Okay, and you guys already know we always gonna post our live on YouTube, so make sure. I am a necklace, not gonna say like that. Necklace gonna give you one priority. Okay, when they ask about choosing the patient, they don't ask you to choose three patients. This is the question that I made by myself, so that's why, because we can have some complex scenarios and rationalizations. Okay, SATA questions will be there when you have to choose like what kind of diagnose, what kind of interventions you need to do. That will be different in med surg. We have done some med surg last week, so those will be easy also. Okay, you can have SATA question in pharma. We have done pharma and we already uploaded it on YouTube. Okay, the nurse is caring for 4 trauma patients. Okay, which require immediate priority: a patient with flail chest and paradoxical respiration, a patient with open femur fracture and oozing blood, a patient with abdominal trauma with rigid abdomen, a patient with wrist laceration controlled with dressing. So, a patient with cervical spine injury reporting numbness in arm. Okay. Yes, JJ, definitely look, and that's why we are going with all the options, because we are gonna maybe we will end up having same kind of answers in somewhere. Okay, in questions. Okay, a patient with flail chest. What's happening? Is it life threatening? Is A life threatening? Yes. Everyone happy with A life threatening? Yes, because what happened, we have a multiple ribs are fractured now, especially 2 or more is usually when we see in flail chest. Yeah, and it can cause segment of chest wall to move paradoxically inward on inspiration and outward on expiration. That's why we say paradoxical. So it is severely impairing, is impairing breathing. Patient is pain, immediate intervention required, pain management, mechanical ventilation, oxygen. So we need to, yeah. Yes, definitely, Emma. We are gonna move to patient number B now. A patient with open femur fracture oozing blood. We know, is it expected? Is B expected? Yeah, and when it is saying the keyword here, we need to, it is not, it is oozing, guys. It is oozing. Is oozing not? Yes, that's what I'm saying, Joy. Okay, oozing is not like life threatening. Okay, oozing blood is not life threatening. Okay, so it is not emergency. So we are not gonna worry about B. Okay, this bleeding can be controlled, this bleeding can be controlled. Okay, and when we can sort out others, we will come back to this patient. Okay, put some pressure on. What about C, guys? A patient with abdominal trauma with rigid abdomen. So we have rigid abdomen now. Is C is just bleeding? Yes, definitely. We are having internal bleeding in C. Okay, and there can be ruptured organ. There can be, yeah, there can be ruptured organ. There can be internal bleeding. So that's why, and it is affecting circulation. It can cause sepsis. So definitely we're gonna look after C also. A patient with wrist laceration controlled with dressing. It is controlled. The keyword here is controlled. Okay, keyword here is controlled. Do we need to worry about? Nah, yeah. So we don't need to worry about D anyway. It is not emergency, it is working fine, it is control, so we all good. Thank you guys, thank you for heart me. A patient with cervical spine injury reporting numbness in arm. What about E? What's happening here? Yes, yes. Likewise, we have done in one of the previous question also, neurological deficit is worsening. Okay, so definitely we need to see patient need immediate stabilization of spine, repositioning to prevent the further damage. Okay, yeah. Okay, who we gonna see first now? We have patient number A, we have patient number C, and we have patient number E. Yeah, E can be temporary, yes. Okay, so who will be first? D is controlled. Mariposa D is controlled, so because this is the keyword, D is controlled. Okay, is A priority? Yes, A is airway, so we will say A first. Then I'm gonna go for C. Okay, circulation, and then I'm gonna go for E. Oh, okay, so D is wrong. I'm gonna go for E. Alrighty. Is yes, definitely. And this one we need to just reposition, stabilize. So yeah, okay. Good work. We only have 2 questions left, and then we will take 5-minute break, and then we will do another go. Okay. Yeah. A nurse is caring for a patient with renal disorders. Which should be seen first? Select all that apply. So we are all having now same kind of patient, all with renal injuries. Okay. So a patient with acute kidney injury and potassium is 7. Okay, so we have acute kidney injuries and we have potassium, and potassium is 7. A patient with chronic renal failure. Okay, this is the word, chronic renal failure, but creatinine is increased. Okay, a patient with dialysis reporting muscle cramp. A patient with peritoneal dialysis, cloudy effluent. A patient with polycystic kidney disease reporting severe flank pain. Okay, who we gonna see first? Is A yes? Is A concerning? What is the normal level of potassium? What is normal level of potassium, guys? We're gonna definitely see A because 3.5 to 5 definitely. Okay, so 7 is quite high. 7 is quite high, and acute we always gonna stay with acute first. Okay, because 7.0 is can cause life-threatening cardiac arrhythmias. Yes, and it is a severe circulation issue. Okay, so we will see patient A. Are we gonna see patient B? Is B is the issue expected? Yes, and B is chronic also. What is normal level of creatinine? If somebody remember, I know it is a finding, it is quite high. Yes, it is quite high. Thank you, YRN. But the thing is that it is chronic, okay, and we can come to patient because he is having CHF, him not immediate life, CRF, sorry, not immediate life threatening issues. So we will come to this person later. Okay, a patient on dialysis reporting muscle cramp. Yeah, see, yeah, it is sudden. It is sudden. Okay, yeah, so we will definitely go with C. Okay, we will definitely, because it is common side effect of dialysis, and but or shall we leave C? It can be life threatening. Yeah, C, yes, we will see C, but from our I will let's see how we will go with D and E, and we can see where we wanna put C. Okay, we will see definitely C. Yeah. Okay, D. A patient with peritoneal dialysis with cloudy effluent. What it is? What D is indicating? We done this one in our last session also. We done yes, no, infection. Yes, infection. Okay, and it can be peritonitis. It can be peritonitis, guys. So it is life-threatening complication of peritoneal dialysis. Okay, so we need to provide immediate antibiotic treatment. So we will see D also. A patient with polycystic kidney disease reporting severe flank pain. This is expected. This is expected. E. Yes, मैं iposa I'm just here and there with C, so that's why I still ticked it, because we can rationalize and we can discuss further. Okay, so we don't need to worry about E. So I'm gonna put C at last. Okay. Alrighty, we have patient number A and we have patient number D. Which one we gonna see first from these two? A and D. A heart. Yes, A definitely. We gonna, cause A is urgent and we know patient can go easily into cardiac arrest. So definitely we're gonna say A first, and then we will give some antibiotic to D, and we will send you know for lab result. We will do investigations, and then let's make everyone happy. Hopefully they will be happy. Okay, we are gonna move to our last question of this session. A nurse is caring for patient on a surgical floor. Which are priority? Select all that apply, guys. A patient with post colectomy with no ball sounds on day 1. A patient post hysterectomy with saturating perineal pad in 15 minutes. A patient post mastectomy with arm swelling. A patient post hernia repair with HR 140 and BP 40. A patient post splenectomy with rigid abdomen. Okay, so this is the reason why I made these questions like SATA and very similar to each, because we can rationalize it properly. Okay, so that's how we need to do that too. If we want to learn real nursing, this is good. Okay, if you just want to go for NCLEX, then you can follow simple things. Okay, what about A, guys? Is A okay? Is A common? Yeah, because this is expected. Okay, A is expected, especially with no ball sound after day 1. Okay, these are very common. It can be temporary ileus, so we will monitor and we will hope that it will resolve it on its own. Okay, next let's move to B. JJ, that part. So absence of ball sound in the first day is expected. Okay, and it is normal. Yeah, it is just sign of temporary ileus. So that's why we will just leave it. It's not immediate concern. B. Uh, a patient post hysterectomy with saturating perineal pad in 15 minutes. What about B, guys? Yeah, I will talk about that after finishing this one. Is B. What's happening? Hemorrhage, postpartum hemorrhage? Yes. Yeah. And is it life threatening? B is priority. Yes. In circulation, life. Yeah. Nice, guys. Okay. And especially in 15 minute, this is life threatening. Okay. Okay, a patient post mastectomy with arm swelling. Is it expected sign? Can we leave C? Everyone happy with leaving C because there can be, yeah, yes, Cami, it can be lymphedema. Okay, so C we are not gonna worry about right now. Yes, yes, Joy, lymphedema, yeah. Okay. Okay, patient D, a patient post hernia repair with HR 140 and BP 80/40. What's happening over there? What's happening with D, guys? That is not good. Internal bleeding, hypovolemic shock. Yes, definitely. Yeah. Okay. D is having issue with circulation. Hemorrhage is going on. Shock can be there. So we will worry about D. Yeah. Yeah. Body is trying to compensate to reduce the hypovolemia. Yeah. A patient post splenectomy with rigid abdomen. What about E, guys? Is E worry? Yeah, we just done two question actually today about that. There was option internal bleeding, emergency bleeding, peritonitis. Especially with splenectomy, you can have peritonitis easily. So they require immediate interventions. Okay, so we will see E also. Okay, now we have patient number E, we have patient number D, and we have patient number B. Who we gonna choose first? Who we gonna choose first, guys? I know which one is most. I think they all are very important. They all are very important. Yeah. So D is also, because D is also hemorrhage. E can be hemorrhage too. E2OR, yes, yes, definitely. E2OR, all circulation. So hopefully we will never get these patients all together. Yeah. But D, we can do some things. We don't have any indication about B. Yes, yes, that's what I was saying. E doesn't have any indication about BP here. So we will do D first, okay, because we know we are having hypovolemia. And then we will do. Can we do D, B, and E? Yes, Ellie? Yeah, Bella, definitely. We will do D and then we will do B and then we will come to E. Yeah, because in E we can't do anything. Okay, right now, actually, before reporting. Okay, and B is gonna be having blood loss, hemorrhage, hypovolemic shock also. And this one definitely we are expecting, the sign is saying. So we will go D, B, and E. Okay. Yeah. Yeah, E volume go back to ER. Yeah, mostly they will. Okay, guys, so this was our question number 11 to question number 20. We will try and we will do another 10 question. Okay, but what I have done, I'm posting these videos on YouTube also, so you guys can actually go to YouTube and you can see our old live. I have uploaded 2 lives today on pharma, and then 2 more uploaded. That will be 50 question in 4 live sessions. So 2 more be uploaded tomorrow. Okay, so if you can't attend our live session, and then definitely C is the answer. No, C is not the answer. C is like expected sign one for lymphedema. So C is not the answer. Okay, I will just put like how we discuss. What we discussed, we will do D first, and then we